In the months following the September 11th attacks, the Bush administration detained and questioned an unknown number of people suspected of having links to terrorist organizations. Physicians for Human Rights has previously documented how doctors and other health professionals working for the U.S. government were complicit participants in the CIA's use of so-called enhanced interrogation techniques. Those torture techniques included waterboarding, stress positions, sleep deprivation, and prolonged isolation. Now, in a new report, Physicians for Human Rights provides evidence indicating that these health professionals did not merely monitor the interrogations. They actually collected and analyzed information about the sessions in a systematic manner, a process that may well constitute unethical and illegal human experimentation. Such research conducted on prisoners without their consent is a gross breach of medical ethics, according to every relevant licensing board or association. It's also illegal under U.S. and international law. It violates the Geneva Conventions and the Nuremberg Code, and the Common Rule, which applies to all federal research using human subjects. In some cases, it may rise to the level of a war crime or a crime against humanity. Because the U.S. government had little first-hand observational experience with the physiological effects of torture, the data helped the interrogators calibrate the degree of pain and stress they were causing to the detainees. And the government lawyers hoped that the research would insulate interrogators from allegations of torture. The lawyers argued that the efforts to refine and improve interrogation techniques showed that the interrogators had no intent to cause harm or were actually acting in good faith. Participants in the interrogations, in effect, committed one crime, illegal human experimentation, to protect themselves from being charged with yet another crime, torture. Health professionals take an oath to uphold the highest ethical standards of their professions, and their primary obligation is the safety and welfare of the people in their care. And that applies equally to sick patients in our hospitals or to foreign detainees in prison cells. When doctors violate the oath, the entire medical profession is tarnished. The violations erode America's faith in the ethical foundations of that profession. To restore that faith, the questions raised in the Physicians for Human Rights report must be answered, and any medical professional who may have conducted the human experiments must be held fully accountable. To learn more and take action, visit phrtorturepapers.org.